Republican Senator Orrin Hatch of Utah, ranking member of the Senate Finance Committee, will get his first crack in 43 minutes. Senator, good morning to you and good day.
Good morning to you.
Your first question to her is what?
Well, there's a lot of questions. I can't really narrow it down. It'll be what I think at the particular time, but we're certainly going to ask about why male premiums are going to go up 99% and female premiums up 62%, why the blue states seem to not have as much problems with Obamacare as red states, where all of these costs are going to jump in the eyes of almost everybody. And of course, we've got to know why she hasn't answered our letters from last April, why she doesn't cooperate with the most important health committee on Capitol Hill, the Finance Committee, and why can't we get responses back on these important issues? There's so many questions it's hard to narrow down to
I'll
one.
give you another one. I'll show our viewers at home the map of Americans who are getting letters every day about a cancellation of their insurance. What do you have to say about that?
Well, that's right. You know, there's going to be at least 8 million. Right now it's over 3 or 4. And frankly, it's going to go up even higher than that. It's not only that, but people can't afford what they're trying to do. And the youth who are supposed to really pay for it all, they're not going to sign up. There are so many problems with this bill. I mean, we predicted that from the start. I think the Democrats have to be embarrassed by pushing this the way they have. And it's been 100% pushed by Democrats. Whenever you have a bill that passes just on a party line basis through both houses, without one vote from the other party, you know doggone well it's a lousy bill.
I'm certain, have heard the clips of the president talking about you like your doctor, keep your doctor, like insurance, keep your insurance, et cetera, like your plan, keep your plan. But that was a lot from 2009 and 2010. This is from September 26th of 2013 in Largo, Maryland. Watch here, sir.
I want to speak plainly, clearly, honestly about what it means for you and for the people you care about. Now let's start with the fact that even before the Affordable Care Act fully takes effect, about 85% of Americans already have health insurance, either through their job or through Medicare or through the individual market. So if you're one of these folks, it's reasonable that you might worry whether health care reform is going to create changes that are a problem for you, especially when you're bombarded with all sorts of fear-mongering. So the first thing you need to know is this. If you already have health care, you don't have to do anything.
How does that sound to you today, sir?
Well, it certainly wasn't true. And whether he knew it wasn't true or not is problematic. But the fact of the matter is, if we had 85% of the American people covered by health care, why in the heck did we throw the whole system out with dirty bathwater and run into this tremendously mystifying, bureaucratically ensnarled, expensive, uncovering system that we have in Obamacare? I mean, we could have taken care of the other 15% one way or the other without doing this, and we probably could have done it at a lot less cost and with a lot less burden to the American people. I mean, these are things that just logically just cry out and say, what's the matter with these people on Capitol Hill,
well, what do you think,
the Democrats who are pushing this doggone thing?
What do you think? What's the solution here?
Well, the only solution I can think of is to elect Republicans in 2014, get both the House and the Senate. You saw that Bill Clinton was not a great president before we got both houses of Congress. Actually, he started to work with us and he became really a fairly decent president with regard to the political structure and how you run the government. I think that's the only way this president's going to become really a very good president, is to have him have to work with a Republican House and a Republican Senate, and I guarantee you he'll either have to work with us or we'll just overrun him.
Senator, thank you for your time. We're watching in 39 minutes. Orrin Hatch from Utah.